Hello, and thank you for joining me today virtually. I'm Susan Cunningham, LCSW, and Doctor of Social Work student here at Southern. I'm honored to be here speaking with you, the faculty and staff of social work and athletic departments, as well as our social work and athletic training students. It's my intention today to heighten your awareness of the connection between athletics, social work, and neuroscience in the supporting of a student athlete through their collegiate career, especially in times of injury and recovery. Together, we can provide a multidisciplinary care and support to college students who are striving for optimal performance. So why is this important to us? Today, we'll discuss the facts that student athletes are in the midst of a very crucial time of brain development, and they have complex lives with competing demands. We'll talk about that no matter how much we plan, sports injuries will happen to most, if not all, student athletes during their career. We will learn how neuroscience helps us to understand the impact of injury and pain has on the brain and the benefits of a multidisciplinary approach for the care and support of a student athlete while they are recovering from injury. So our learning objectives today hopefully will be that we will be informed of the pressures of being a student athlete. We will also increase our knowledge of adolescent brain development. We will have a broader understanding of injury and associated pain. And we will become aware of biopsychosocial factors of pain. And hopefully, we will be better prepared to provide emotional support to student athletes dealing with injury, pain, and recovery. So let's start with understanding the demographics of the National Collegiate Athletic Association, or the NCAA, student athletes. So according to the NCAA in 2022, there were 350 member schools. There were 24 sports represented, and those athletic teams were comprised of 520,470 students competing nationally. That broke down into 294 plus male athletes and 226 plus female athletes. Here at Southern in 2022, we had 11 sports teams represented in Division II NCAA, which were comprised of 277 male athletes and 247 female athletes. Now that we know the representation of student athletes across our campus and nationwide, I want to set the tone for our discussion by providing some foundational information regarding the developmental stages of the adolescent brain, as the age range for college athletes is between 17 and 24 years old. It's also important to note and remember throughout our conversation today that each individual is different in the stages of their brain development and how they experience things in life. Therefore, pain and recovery will be experienced differently by each student athlete. Other than during the first 3 years of life, adolescence represents the period of time which the brain changes most dramatically. From the onset of puberty through the early to mid-20s is when young people will explore, adapt, and learn through active engagement with their environment, with relationships, and by trial and error. Identities will be shaped and reshaped. Social bonds will be forged and reforged. Neural network connections in the frontal lobes continue to grow and strengthen through this time. Areas of the brain involved in reward, motivation, and emotions also will continue to develop. The ability to reason about abstract concepts is also under development, and emotions are heightened in intensity and urgency. The changes occurring in these brain networks can result in heightened vulnerability to risk-taking, recklessness, and sensation-seeking behaviors, especially when in front of peers. In addition, adolescence is a time in which navigating complex social situations and mastering strong emotions is particularly challenging. During this time of significant changes in the brain, circuitry associated with decision making, adolescents benefit from sufficient support, guidance, and monitoring from pro-social adults. So, contrary to popular opinion, adolescents do need us in their life. Too often, adults withdraw from adolescent lives prematurely, leading young people to navigate difficult situations alone or solely with their peers who are also developing. Rather, pro-social adults, including all of us here today, need to be reminders to those adolescents to regularly engage their cognitive control system. And sometimes we may even have to serve as that control system, limiting their opportunities to engage in risky behaviors. So connection with positive adults on campus is vitally important, as adjustment to college years is difficult for most students, if not all students, and student athletes included. So, unless we are in the shoes of a student athlete, we cannot understand the complex pressures placed on them. Let's take a look at the different domains of the daily life of a student athlete. Academic performance is a significant source of stress for most college students. This stress may be further compounded among collegiate athletes based on their need to be successful in the classroom while also excelling in their respective sport. Most student athletes engage in a full course load, 12 to 15 credit hours, which can relate to about 10 to 12 hours in the classroom. Athletes who are on scholarship must maintain a specific GPA to maintain their eligibility for their scholarship and to play. Overall, athletes report spending about 30 to 40 hours a week on academic-related activities. The governing rules of the NCAA state that collegiate athletes may only engage in required athletic activities for 4 hours a day and 20 hours a week during in-season and 8 hours a week during off-season throughout the academic year. College athletes report spending approximately 30 hours per week in season in training, practices, meetings with coaches, and competition. This does not take into account any time they may need to spend for injury treatments or mental health counseling. An average of 56 athletes report spending just as much time as their sport during off-season as they do in season. Only about 2% of college athletes receive scholarships, which leaves many student athletes working part-time. Part-time work on and off campus is estimated to be about 15 hours per week. These numbers show how important it is for student athletes to develop time management skills to be successful in both academics and athletics. Overall, most student athletes have expressed a need to find time to enjoy their college experience outside of their athletic obligations. Despite that, because of the increasing demand for excellence in academics and athletics, student athletes feel free time with family and friends is often scarce. As we already mentioned, adjusting to college life is a very stressful time. We know that emotionally well-adjusted individuals generally cope better when stress occurs in their life. Research on the growth versus fixed mindsets has found that people who hold more of a growth mindset are more likely to thrive in the face of difficulty and continue to improve, while those who hold a more fixed mindset may shy away from challenges or fail to grow. As you see here, the concepts held within the growth mindset are in a positive tone. I can do this. Failure brings opportunity. I'll try a new way. I'll keep practicing. Where, in contrast, the fixed mindset is more closed and rigid. Why bother? This is too hard. Failure's the end. Coach doesn't cut me a break. So those thoughts are more rigid and adverse to learning or developing. Student athletes who adopt a growth mindset will find themselves more adaptable to crisis situations and able to find a way to reset when adverse things happen, such as injury. To develop a growth mindset, you need to be around those who have already adopted that mindset and are encouraging you to also do the same. We're now going to watch a short video from Dr. Jonathan Fader, a sports psychologist who's going to talk about the concept of keeping your head in the game.
Keeping your head in the game are learning certain strategies and having a routine that helps you bring your best mental state to every performance on and off the field. When you think about keeping the head in the game, the first thing you have to understand is what your head is. Most people don't have a user manual for their head, right? They just get up in the morning and live their life. And we're really not taught about the different skills that can help you focus and keep your attention on the right thing at the right time every time. Most athletes, if you ask them, what are you doing to prepare? They'll give you a very thorough background about what they do physically. They'll stretch, they'll do strength and conditioning, they'll eat right, they'll try to sleep right. But most athletes really actually aren't working on mental conditioning. I'll give you an example. I was working with an MLB player, and I noticed that when an unwanted result would happen, like someone would get a hit in a situation that really wasn't ideal, he would just be dejected. He would be sad and overwhelmed. And so, I remember asking him, when that happens, what do you do? And he said, well, I just shake it off. But then I asked how, and he couldn't really tell me. So what that experience shows is most athletes and most people don't have a go-to mechanism, a mental technique, something they're going to do to reset. So what are things that you can do to be able to reset? There are lots of things you could do, and mostly the word that I use is do. It's really hard to think your way out of a situation. It's better to do your way out of a situation. So what I recommend to athletes is have a go-to resetting action that they do. Now, the best one is really getting in contact with your breath. A deep breath in, a deep breath out. There's a physiological process that happens where your body relaxes when you do that. It can also help to clear the mechanism and be able to focus on the next play. Also helpful sometimes is having a reminder, a cue word, or self-talk we call it, that you can say to yourself, here, now, next play. Just instructing your brain about what the next thing you're focusing on. The more you practice that off the field or off the court, the more calm and in the moment and feeling good and happy an athlete is, just satisfied and relaxed, the better they're going to play. These are natural athletes, and all they need to do really is to relax and allow themselves to be there. And a lot of these skills are about allowing the natural talent to come out.
So as we just heard from Dr. Fader, in his experience, most athletes do not have a mental technique to reset from a negative experience. Keeping your head in the game is a saying often heard and used, but maybe not so much understood. Developing a go-to mechanism or technique to reset from a bad play or negative experience is vital to bouncing back. There are times in the lives of athletes when the philosophies of the growth mindset are inadvertently turned into negative thought patterns. When under pressure, the brain activates survival mode, creating nervousness and making it more difficult for an athlete to perform. On this slide, we see common mantras of athletes and coaches. These mantras are seen as motivational, encouraging development, and fundamentally, they are true. However, when you hear no pain, no gain, play through the pain, these are common retorts when an athlete injures him or herself. Yet, ignoring pain can have severe consequences for one's long-term performance, health, and overall well-being. When the focus on the effort supersedes the recognition of progress, maladaptive behaviors could develop. It may be true that we learn from mistakes and failures. Growth happens in discomfort. However, when in constant survival mode, the brain is looking to prevent bad things from happening, which could be counterproductive to an athlete's performance. When injuries occur, the physical body suffers trauma and needs appropriate time to recover. Rushing back to play or no time off is often a precursor to re-injury for many athletes. We have to also attend to the emotional responses to injury, which are often overlooked. Mental toughness is a trait that helps athletes excel, but it can become maladaptive when injuries or emotional stress are overlooked and become detrimental to the athlete's health. By developing a technique as described by Dr. Fader, it is possible to counteract the constant survival mode and can also help attend to the emotions which occur with an injury. Injuries will happen. Injuries are common among student athletes, with an estimated 90% of athletes reporting at least one sport-related injury during their career. The occurrence of repeated injury is possible, very probable, and it affects the athlete's development and causes physical and mental burdens, and may also lead to premature end of their sports career. A study completed of Canadian college athletes found that competitive athletes sustained an average of more than 2 injuries each year, with ankle, knee, and shoulder injuries being most frequently reported. The injury profile appears to differ according to the type of sport. The high prevalence of injuries among student athletes should be a concern to all of us, as we all have an important role to play in designing tailored injury prevention programs. For the purpose of today, when we speak of injuries, we will not really be talking about concussions. Concussions are a very unique injury and require specialized care, which is a topic for another day's discussion. So what are the different types of injuries? We're going to look at these 2 types of injuries today. And again, we're not going to dive deep into injuries themselves. We're going to be talking about the overall occurrence of injuries, the impact on the brain, and the healing process. So acute injuries is an injury defined as trauma resulting from a specific and identifiable event. Most injuries in sports involving high speed or full body contact is where you may most likely acquire an acute injury. Acute injuries can be of any part of the body, and they can be minor, like a bump, bruise, or a scratch, or they can be very significant, such as broken bones, torn muscles, and ligaments, which would require surgery. Overuse injuries, also sometimes called chronic injuries, are a category of sports-related injuries that result from cumulative trauma or repetitive use and stress of the same part of the body. Overuse injuries occur when inadequate time is provided for the injured area of the body to heal properly. So many professional teams and even collegiate teams have put in rules to try and eliminate or reduce the occurrence of overuse injuries. Typical examples of overuse injuries are tendinitis, bursitis, or stress fracture, and they often occur in low-contact sports that involve long training sessions or the same repeated movement over and over again, such as this young man in the picture who is a pitcher. An overuse injury for him could occur in his rotator cuff in his shoulder. Consequences of acute and overuse injuries include loss of playing time, reduced function, psychological exhaustion, and significant pain. Because overuse injuries are associated with a gradual increase in symptoms, athletes may be unaware that they are seriously injured. Overuse injuries may present not only physical, but psychological challenges that could significantly affect an athlete's recovery and performance. Furthermore, undiagnosed and untreated overuse injuries can produce long-term residual symptoms and health consequences, including deformities and arthritis. So, although, for the most part, participating in sports can be a protective factor against emotional distress, many athletes who sustain an injury are at risk for major depressive disorder, post-traumatic stress disorder, or an adjustment disorder. A main priority of a student athlete, as we all know, is participation in their respective sport. When competition is restricted due to injury, regardless of the loss of playing time, how long that is, there is a higher chance of an athlete experiencing a negative impact on their mental health. Again, only 10% of injured athletes experience long-term psychological effects. However, research has found that injured athletes experience clinically significant depression 6 times as often as non-injured athletes. And student athletes also exhibit significantly greater anxiety and lower self-esteem after a 2-month follow-up. Those with more severe injuries are more likely to become depressed and fear not being able to play again. Non-injured athletes seem to experience depression at the same rate as the general population. Athletes who achieve higher levels of success have higher levels of depression and suicidal ideation after an injury. An athlete may have a higher rate of feelings of worry or fear if the injury may lead to an early ending of their career. So an athlete's injury should also be analyzed for meaning. What may seem significant to one person may be quite different for another. As we said earlier, everyone experiences things a little bit differently. When injury makes athletic activity impossible, a student athlete may suffer more distress than someone who doesn't even play sports or exercise. So understanding the significance of the experience for an athlete is crucial to achieving a recovery plan for that athlete. For example, to a non-athlete, a fractured wrist may be just an annoyance, something they have to deal with. But for a student athlete who is a pitcher on a softball or baseball team, and there are scouts that are coming to recruit, that would be disastrous for them. So along with injury comes a loss of identity and perhaps also a feeling of isolation from their teammates, because athletes often use their sport as an outlet for emotional expression. When an injury removes that outlet, athletes may develop anxiety and disappointment around their circumstances. When they're left alone to manage these, an athlete may become irritable, passive, socially isolated, depressed, or as we mentioned, the worst case scenario is suicidal. Without the support of their teammates or coaches, athletes may feel as if they're unable to cope. So remember, we said in the beginning that athletes spend about 30 to 40 hours a week with their teammates. When they're injured, they're probably not spending that much time with individuals, and they may not have many friends outside of their teammates. So this would leave them in situations of feeling isolated. Fear of pain and inaccurate beliefs that movement or activity will cause further harm can also lead to activity avoidance, which then leads to physical deconditioning and maybe even long-term disability. So there's a bidirectional relationship between pain, anxiety, and depression, stress, and anger. These feelings can also be heightened when a student athlete is going to make time in their already busy schedule to have to go to rehab or physical therapy sessions, which are not often in the place of practices, but in addition to them. So even an athlete who's been returned to play, who may continue to still need some physical therapy, is going to have to figure out when that's going to happen. Some athletes may even continue to play with an injury to hold on to scholarship or even just status of being a student athlete. Some continue to play even they don't no longer enjoy the sport because they don't want to let down parents or coaches who have worked so hard to try and get them to where they are. But most of all, the pressure to continue to play despite injury comes from the athletes themselves, right? We know the culture of sports is no pain, no gain, and no time off, and work through it. And the athletes don't want to let themselves down. And so sometimes they will also force themselves to play through the pain. So we talked about injury, so let's just talk about some biopsychosocial factors of pain, right? These are concepts and factors that are important to understand. So biological factors of pain are related to the pathophysiology symptoms, which include the stress, infection, or tissue damage that's disrupted the body's homeostasis, right? So in traditional biomedical model, when tissue is damaged, it's natural to feel pain. Psychological considerations for pain bring about the neuromatrix theory, which suggests that pain is produced by patterns of nerve impulses. These impulses come from a neural network in the brain known as the body self neuromatrix, and everyone has a distinct neuromatrix, and it's modified over time through sensory and our experiences and memories. And the neuromatrix determines how pain is experienced by us individually. So patterns of nerve impulses can be triggered by a painful stimulus, such as injury or illness. However, they also can be triggered by other factors, such as chronic stress. So in light of this theory, treatment of pain involves removing chronic stress or other factors that may be triggering the neuromatrix to feel pain. So treatment can focus on reassuring the body it's not in danger. It also involves exposure to both sensory and non-sensory inputs that trigger the neuromatrix with the goal of adapting the response of the neuromatrix, reducing or eliminating pain caused by those inputs. So an example of the link between the biomedical pain model and psychological pain model is something we call pain catastrophizing. So pain catastrophizing is defined as a cascade of negative cognitive and emotional responses to pain. It's a construct constituted of magnification of pain, rumination of pain, and feelings of helplessness over pain. So pain catastrophizing is associated with the greater use of pain medication and increased pain intensity and disability, and a poor response to pain treatments, which relay back to the psychological factors of pain. So there's an overintensity of the feelings of pain, which lead to psychological impacts of pain, and those two things just keep feeding off of one another. So the social support or social role of a person is also a factor in how they experience pain. So social support has frequently been studied along with one's role in a family or a workplace or an athletic team. The operant theory of pain behavior proposes that increased pain behaviors are evident when the desired outcome is achieved. So, encouragement to avoid an undesired activity or positive reinforcement when pain is displayed. Yet, the effect of social support is conflicting, as some people may display more pain in the presence of others in a way of seeking support and attention, whereas others may display less pain behaviors dependent on the lack of support or attention, or wanting to seem as if they're not injured or in pain. So this evidence demonstrates the consequences of the social factors in how we all experience pain. And these factors are not reflected in the biomedical model. So what does this all mean? It means that to understand the experience of a student athlete who is dealing with injury, we must take into account the biological, psychological, and social factors that are present in their life. There are also different types of pain that are generated by the body when it's injured. So it's also important for us to understand these different types of pain when we're assessing a student athlete and where they may be in their injury and in their recovery. So we'll start off by talking about nociceptive pain. And nociceptive pain is a type of pain caused by damage to the body tissue, and it usually feels like sharp pain, aching, or throbbing. It's often caused by an external injury, like a sports injury would be. And although nociception is very influential in pain, pain is also modulated through the nervous system, and we'll talk about that in a little bit. So nociceptive pain occurs mostly in the leg, arm, and back areas. And this is categorized, the different types of nociceptive pain are also categorized as radicular, somatic, and visceral. So radicular pain occurs when the nerve roots are irritated. So it's a pain or a feeling that goes down your arm or leg through a nerve that comes from the spinal cord. So for example, when a nerve is pinched in the spine, it causes numbness, weakness, and tingling, among other symptoms. Okay. Somatic pain happens when any of the pain receptors in your tissues, such as muscle, bone, or skin, are activated. This type of pain is also stimulated by movement, and it usually is localized. So a cut, an abrasion, a headache are things that we talk about nociceptive pain. Visceral pain happens when internal organs, such as involuntary heart muscles, are injured or inflamed. So visceral pain is usually described as aching, and sometimes the location might be vague, like we're not really sure where the pain is coming from. So nocipathic pain, and maybe some of your athletic training students, you might know this better than me. So nocipathic pain is pain that arises from altered nociception despite no clear evidence of actual or threatened tissue damage. So there's no clear injury, but there's pain that's being felt. So that is what we consider nocipathic pain. And again, we can have an entire day training just on these types of pains. Neuropathic pain is pain caused by a lesion or disease of the somatosensory nervous system. So neuropathic pain is a clinical description and not a diagnosis. Neuropathic pain in student athletes can develop following surgery or sport injury, or from repetitive mechanical and inflammatory irritation of peripheral nerves, such as from endurance sports that we discussed. It's important that treatment for neuropathic pain occurs with the understanding that the primary contribution is the nervous system rather than a tissue injury when we're dealing with neuropathic pain. Then lastly, we have pain of unknown origin, which usually is not classified as nociceptive, neuropathic, or nocipathic. So athletes can present with one or any combination of these types of pain. And it's through thorough and precise questioning regarding the location of the pain, which is critical for understanding the likely contributions of the type of pain they're feeling, right? So athletes will commonly point to a singular event as a cause of pain, but as those assessing them, after careful questioning and examination, we may reveal a range of possible contributing mechanisms. For example, a single overhead serve by a tennis player may precipitate shoulder pain, but biomechanical, social, and psychological factors may also be present and relevant to the type of pain being felt. So regardless of what type of pain we're talking about, when it persists long term, and especially when it's in moderate to severe pain levels and limits activity, it is often going to be accompanied by psychological distress, which often will show up as anxiety and depression. And athletes may also develop sleep deprivation and eating disorders, which then will impact their physical and social activities. So these are all very important things to consider. So what is acute pain? So we've talked about nociceptive, nocipathic, neuropathic, pain of unknown origin. Acute pain is the pain felt at the time of an injury. It occurs suddenly. It's the body's way of telling us something went wrong. And acute pain is usually felt in the area of where the injury happens. It could be sharp, feelings of heat, or throbbing. It's important to know that acute pain will eventually go away. There are several brain regions activated during the experience of acute pain. The prefrontal region and the limbic system, composed of the anterior cingulate cortex, the amygdala, the ventral tegmental area, and the nucleus accumbens, are associated with affective aspects of pain and regulate emotional and motivational responses to the pain. So these brain regions are not activated separately. They are functionally connected and contribute in a combined fashion to pain processing. So changes in emotional and motivational cues can affect the intensity and degree of which pain is experienced. So several studies have investigated the brain areas associated with the emotional aspects of pain. And since the medial prefrontal cortex and the nucleus accumbens are involved with emotion, motivation, and reward-related behaviors, this suggests that the processing of pain perception can be influenced by changes in these connections. Right? So this goes back to where we are with adolescent brain development and how it impacts feelings of acute pain for student athletes. So literature has demonstrated for decades that chronic pain, which is pain lasting or recurring for 3 months, is a complex phenomenon which requires recognition of multiple factors, including what we've already talked about, biological, psychological, and social influences. The International Association for the Study of Pain acknowledged the difficulty in determining psychological versus pathophysiological pain, and has defined pain as an unpleasant sensory and emotional experience associated with the actual or potential for tissue damage, right? So to account for this complexity in recent years, researchers and clinicians have focused on a biopsychosocial model, which includes a consideration of the person and his or her social context. So, as the experience of chronic pain is associated with activity in the central nervous system, and as a result of multi-network activation in the central nervous system, chronic pain comprises multiple components, including sensory, emotional, cognitive, and behavioral elements. It is the residual effects in the brain where the nerves have become oversensitive and continue to send warning signals to the brain even when there's no injury, that there is a threat or harm, and the reaction is feelings of pain. If pain becomes chronic, it can significantly reduce the quality of life for any individual, not to mention for student athletes. So in order to develop appropriate therapeutic targets for chronic pain, it's important to understand the factors that affect the transition of acute pain to chronic pain and the mechanisms underlying the development of chronic pain. So the chronic pain cycle is complex, and it starts with the sensation of pain, which can lead to inactivity or fear of re-injury. These fears may cause the student athlete to avoid physical activity, which is needed during recovery to remain in shape, right? We don't want to be deconditioned during an injury. We want to remain in shape. So fear of inactivity, in addition to the feelings of pain, can disrupt the sleep pattern. Sleep is essential for physical, mental, and emotional recovery. Okay? Lack of sleep inhibits recovery and can lead to increased fatigue and loss of appetite. So proper nutrition provides the required energy for athletes to train and compete. An unhealthy diet, in addition to poor sleep, can make an athlete susceptible to re-injury and illness, and it also inhibits the healing process. So as athletes struggle with these physical concerns, they may begin to feel frustration and anxiety about the recovery process. As we previously discussed, it will be important to understand the psychosocial factors that are also in play here. So an athlete's desire to return to play, contrasted with the time it may take to recover from an injury, may lead to feelings of anger and depression and potentially self-hate, which all lead back to the feelings of pain. It's important to understand the type of pain and where an athlete may be in their healing stages of the injury to determine if they are experiencing chronic pain or if they have been re-injured. Garnering an understanding of how much the pain impacts the athlete's ability to participate in activities, including the sport, but also other activities, and when the pain persists beyond the expected, and are there emotional factors to consider? This can serve as a springboard for discussion about the athlete's current state of activities and have they changed because of the pain. And all of this can guide a treatment plan aimed at restoring normal function. And the normal functioning would be for them to return to play, for them to be able to return to their academics, and for them to be able to be emotionally and mentally well. The general rule relating to the duration of pain is the longer the pain persists, the less likely it is to be reflective of tissue damage. So for individuals suffering from moderate to severe chronic pain, it is more likely that a multidisciplinary treatment approach is indicated to improve the pain and psychological functioning of that individual. So that leads us to thinking about, what do we have to do to the brain to get it back to functioning? So chronic pain entails structural and functional changes in the cortical limbic brain regions, such as we've mentioned, the prefrontal cortex, the anterior cingulate cortex, the amygdala, the hippocampus, and nucleus accumbens. So changes related to chronic pain can induce negative affective states, such as depression, anger, anxiety, and underpinned by common neuroplasticity changes in chronic pain and negative affective states. So the transmission of pain signals across the synapses involves various neurotransmitters, and they play an important role in the development of chronic pain. So it must be acknowledged that I have not dived deeply into the technical scientific explanations of all the factors influencing the shift from acute to chronic pain and changes in areas related to pain. But pain has several important dimensions, right, that we've talked about: sensory, emotional, and cognitive. The sensory dimension of pain involves how we perceive pain signals and the amount of pain we recognize. The emotional dimension of pain indicates how we feel about the experience of pain. And the cognitive dimension of pain entails how we interpret pain and how we respond to pain stimuli. So the process of rewiring the neural pathways of the brain that have been altered due to the feelings of pain, chronic pain, and injury are going to require some experimentation, some patience, and some consistency. Simple things that can be done are practicing good nutritional and sleep habits while engaging in physical activity appropriate to the level allowed by the stage of the injury recovery, because we don't want to get re-injured. Targeted rewiring of the brain is the process of undoing the learned habits of chronic pain. So the nervous system, it's exceptionally plastic. It molds and it picks up habits easily. So just as the nervous system picked up the habits associated with pain, we can retrain it towards healthy habits not associated with pain. So science-backed techniques can greatly assist in this process. So some common techniques are equipping ourselves with knowledge of how pain works, which is partly what we're trying to do here today. The brain processes chronic pain using its fear system. So in order to reverse the cycle of pain, the rational part of the brain, the prefrontal cortex, often needs to get more involved. So simply learning about how pain works can help the prefrontal cortex play a larger role in reducing our habits related to chronic pain. So to help the nervous system feel safe again, it's critical to understand what made it feel unsafe. So this can be completed through psychological interventions for chronic pain, which include some behavioral therapies, operant behavioral therapy, cognitive behavioral therapy, motivational interviewing. These approaches focus on factors that influence chronic pain, such as failure to liberate pain responsive, maladaptive responses we've developed. So with the help of clinical social worker or a therapist, A student athlete can gain an understanding of the nervous system journey into their pain, and this will assist in developing a clearer roadmap to the way out of the pain. And as student athletes consistently practice a combination of these two interventions, the neural pathways will reshape themselves. So, armed with a new perspective on pain, it's possible to start teaching the nervous system new ways of coping. So, physical activity, feeling joy, feeling gratitude are powerful habits that release natural pain relieving chemicals. The more of these habits that are practiced, the more comfortable the nervous system will feel, and it will feel safe, and it will reduce the feelings of pain. So we've discussed how it's important of healing the body and rewiring the brain. And so Dr. Matthew Sacco of the Cleveland Clinic provides these insights into the importance of the mind-body connection in the healing process. So what Dr. Sacco tells us is the body needs the mind so it can reach its maximum potential, especially after injury. Research shows that if you have a realistically optimistic look, like recovery is going to be tough, but I'm going to get through this, you're more likely to quickly and completely recover than if you have a negative outlook where it's, I can't believe this happened to me. This is the end of my career. It's important to also address a student athlete's thoughts about their injury, because understanding the athlete's thought about their injury will help to develop the treatment plan that includes the appropriate level of social support. So we've already talked about this, that brain integration, that being connected to others is going to help the process of healing. So attending to the emotional and psychological impact of injury will decrease the likelihood of the development of maladaptive behaviors. So again, Dr. Sacco reminds us that the exception to this is the concussion. Concussions are more challenging. They don't have the predictable timeline, and fundamentally, they're a different type of injury. So concussions would require further examination. Okay. So we've talked about all these great strategies that we can help to equip student athletes with, and we also have to look at what the common hurdles to healing might be, how they might appear. So for a student athlete, the psychosocial factors that linger even after the injury has healed are sometimes are what cause barriers to healing. So Dr. Sacco again tells us that the hurdles that are most commonly appear in a student athlete's life while they're in the process of recovering from an injury is that pessimistic outlook, right? If the inner voice of the athlete skews them towards that half-empty view, that half-empty glass view, like I'm never going to recover, like we just talked about. That pessimistic outlook can hamper their recovery process. That goes hand in hand with that all or nothing attitude of black and white. If I don't get better fast, if I don't get better and play like I used to, then I'm a failure. So that kind of thinking, which is linked to the mental toughness concept we talked about before, is a strong drive for success that you see in student athletes, but sometimes can be counterproductive when they're in times of stress and healing. So being rigid in psychological thinking can make it difficult to recover when something unexpected happens, or maybe when it takes longer to recover. Another hurdle to healing might be the fear of re-injury. As athletes progress stalls, or they feel like they're not on track, it's a fear of re-injury that keeps them from pushing themselves to go forward. It's hard to differentiate between hurt and soreness that is part of the healing process and when you're re-injured. So athletes may react to all of the pain, as we talked about before, in a catastrophic way, and just a mere sliver of a doubt that they have been re-injured is going to totally bring the recovery process backwards for them. Everyday stressors, things that cause stress in our life that maybe if you weren't a student athlete, maybe wouldn't bother you at all. But there are some real stressors that they have to think about. And if we think back to the complex life that they lead, they might be worried about their eligibility to play. They might be frustrated over now having obligations to spend time in recovery, in injury recovery. They might have a lack of access to affordable medical care. Not all athletic programs offer comprehensive athletic care for injured students, and they may have to go find it on their own through their own insurance coverage. And many students may not have, their families may not have access to high optimal care. This might cause relationship issues for them. They might feel some resentment towards their teammates who are playing. And this then also causes stress for them in the classroom because they may be so focused on their recovery that their academics may be suffering, or the recovery process is just taking such a toll on them that their academics are suffering because they're feeling depressed or anxious and just hopeless. So athletes are often given a message that when they stepped on the field, you have to leave everything else behind, right? But it doesn't work like that. So Dr. Sacco said to us, it's like telling someone, don't think of pink elephants. You automatically start thinking of pink elephants. So when we're telling our student athletes, ignore all of these stressors that are around you and focus on what you have in front of you, it's very difficult for them to do that. Life stressors affect you emotionally and physically, right? So one example is when you're stressed, digestion stops almost entirely in your body. So this is one reason why some athletes may become sick and start to have stomach issues or digestion issues, something they didn't have before. Our body also does not actively engage in resting or healing. We have to force our bodies to rest. So as a result, being worried or stressed can directly affect our body function, including its ability to recover. There's also the stigma associated with mental health issues. Because many people have never properly addressed mental health issues, while playing sports and being active helps some people cope with anxiety and mood disorders, an injury often removes that outlet, that coping mechanism, and the depression or anxiety that may have been kept at bay now starts to creep back up. So it's important for us, thinking of all the hurdles we just talked about, a benefit in the involvement in athletics generally is the opportunity to develop strong social support networks and meaningful relationships, as well as a sense of belonging to a community or greater cause. Social support is defined as individuals who a person can rely on during periods of stress. So it's important for us to understand what resources our student athletes have who are coping with an injury. And the stronger the social support network, it's a protective factor against mental health challenges for that student athlete. Social supports could buffer the effect of stress on the injured student athlete, therefore indirectly influencing their emotional well-being. In other words, Social support could first help mitigate the stressors. The stress relationship that an injured athlete with more social support post-injury tends to report a lower level of stress than those with limited support. Social support can also help an injured athlete cope with the injury and improve motivation for their rehabilitation. While there is some uncertainty regarding the timing and type of social support needed at various stages of the recovery process, previous research has said that strong social support networks buffer us from mental health complications. Another important aspect of successful recovery is a trusting relationship. So, a patient experiencing chronic pain or injury will have seen numerous medical practitioners and participated in numerous assessments and treatment or medical protocols. It is of utmost importance that the professionals providing care use a client-centered approach to validate the pain, engage in active listening while maintaining empathy and confidence, and express empathy and understanding. This will allow clients to perceive that their feelings and symptoms are being acknowledged. Professionals should strive to build strong therapeutic alliance and maintain it during the rehabilitation process to promote effective pain management. 3 components of a good therapeutic relationship identified by Carl Rogers are empathy, positive regard, and congruence. Rogers' 3 ingredients cultivate a therapeutic relationship where the provider of care shows that they care about the client, they are not judgmental, and they are genuine towards the client. So when therapists or social workers or athletic trainers or doctors or coaches follow these 3 ingredients with the student athlete, it facilitates that relationship and fosters success. So we should all know that we need to know when empathy towards our student athlete and when we need to push them through a situation. So finding that balance of being empathetic, understanding, and non-judgmental while still providing them with the strong encouragement and sometimes support that they're going to need to push through their recovery process. So I hope through our conversation today, we have been able to see the intersection of social work, athletics, and neuroscience. So social workers aim to enhance the well-being and basic needs of all people. But there's particular attention given to populations that are considered to be vulnerable, oppressed, or marginalized. There are cases recognizing that for student athletes could be considered vulnerable population, for which social workers should provide services. Social workers could provide initiatives to improve mental health literacy among student athletes. And recent studies show, and as we've talked about today, student athletes are susceptible to mental health issues. Social workers in athletics could promote social justice and social change by focusing on the unique needs of athletes at both individual and environmental levels. Social workers could promote mental health literacy at a micro and macro level. We can achieve these aims by working together with you as a professional network of social work, athletic training, medical fields, athletics, sports administrators, and other licensed mental health professionals. And by understanding neuroscience and brain development, injury, and recovery, that will help us provide that holistic care to student athletes that we talked about today. So we've covered a great deal of material today, and it is my hope that we can come away with these takeaways. That student athletes have a wide range of demands on their daily life, and many regions of their brain are still developing. Injury is a common occurrence with student athletes, and repeated injuries are very probable. Injuries impact both the physical body and the structure of the brain. And it's very important for us to understand the biopsychosocial impact of pain, and this will assist us in providing a holistic approach to the recovery of a student athlete when they're dealing with injury. I'll now take any questions or feedback.